So this is an incredible evening to be in beautiful Novato, celebrating the 50th anniversary of Marin Community Clinics. So let's make some noise for that. As we all know, it was 50 years ago, very, very humble beginnings, a church basement. Can you imagine that? And then the great graduation to a beautiful, the double wide trailer up on the hill. And from those humble beginnings, MCC provides a full range of both primary health care, dentistry, behavioral health, obstetrics and gynecology, family planning, optometry, chiropractic, and specialty services. So we've come a long way, baby.
As I watched what was happening between this wonderful connection between patients and staff, amongst the staff, this shared mission of treating an undervalued and unseen population that's marginalized, there was magic happening. Those connections were just so compelling. I knew that's what I had to do. And as the clinic has grown, it's been really magical. So we went from that double wide trailer serving about 5,000 or 10,000 patients to now we're up to around 40,000 patients, 250,000 visits. But what hasn't changed is that magic, that sensibility, that caring, and the laser focus to bring what needs to be brought to this community who is so deserving. And that is incredibly rewarding. It is really hard work. It's super challenging in any environment, especially at FQHC. But as my colleague Dr. Lisa Ward says, it is good hard work, and that is so true. There's been legislation that has expanded Medi-Cal access to people who are undocumented. Finally, recognition of people that get health care not based on their citizen status or their ability to pay, but just because they are fundamentally human beings that we should care about and take care of. And I'll tell you, these patients that we see every day, we see amazing people. People that are marginalized, that do their best, they go to work every day even though they don't be recognized, they don't have a political lobby. People sending home money, working 2 or 3 jobs. People disabled, still putting their best foot forward. We serve an amazing population, and we are proud to do it. And I really thank our political leaders in California.
The clinics promote a vision that I share, that all human beings deserve health care. The care offered by the clinics to our county's most vulnerable patients isn't just professional, clinical care. It's heartfelt human care. It's the kind of care that heals those who struggle and suffer. You all dynamically demonstrate how community care should be delivered to those who need it the most. And you and your predecessors have been delivering this heartfelt, hands-on care, not only in 2022, during the COVID pandemic, but also historically for 50 years. Novato Spirit enables each child to be engaged fully in an athletic activity for 5 years. And during this time, the children learn how to move through their difficulties. Over the years, our kids learn how to tap into their own emotional, mental, and physical energy to do their best, even if obstacles block their path and forces threaten to keep them down. In a small way, Novato Spirit strives to do what the clinics do in a big way. You activate your intelligence, your resources, and your heart to ensure that each patient does not have to make a difficult journey alone.
You may have heard the term safety net, and that's actually how a lot of federally qualified health centers started in the social justice movements 50 years ago. We need to have a net to catch people that are falling through the cracks of the traditional healthcare system. I've long thought that's nice, but that's not good enough. The net needs to be a trampoline. We need to help people bounce up and not stay caught in the net. That's part of our broader vision, I think, and story of impact at Marin Community Clinics. By ensuring someone is healthy, it means they can provide for their family and work. Health is foundational. The goal is for everyone to have access to health and well-being that they deserve. That's what equity is all about. It's about meeting people where they are. And at Marin Community Clinics, we're experts at meeting people where they are and helping them get what they need to access healthcare services.
MCC has had an unwavering vision and mission While the name has changed and we've moved from church basements and double wides to now several facilities located throughout Marin County, the work has not changed. The ethos to make sure that anyone who comes to their doors, whether you are insured, underinsured, uninsured, if you are in need, irrespective of your sex, race, gender identity, sexual orientation, and certainly the ability to pay or not, you are in a place where you are guaranteed to be treated with respect and to get quality health care as many times and as often as you need it. Now, you've heard, and when I was telling friends about this event, everyone said, "Isn't everyone rich in Marin County?" Haha. We know that is not the case. There are people really struggling to make ends meet, and some people who are not making those ends meet and need to have quality health care. And that is the space that Marin Community Clinics has sat in proudly, unwaveringly for 5 decades. I know there is so much passion for this organization. I encourage you all to keep following them on social media, be as generous as you can, and let's all do this again next year and in another 50 years for Marin Community Clinics. Thank you, and have a wonderful evening.